everyone. This is April Garrett with Seniors Blue Book, and today on our Senior Care Spotlight, we have Bobbi Kolonay, who is the president of Holistic Aging Options for Elder Care. How are you doing, Bobbi?
As good as could be expected during these trying times for people working in elder care.
Yes, it is very challenging. So why don't you start off by just explaining the services that Holistic Aging provides to older adults in the greater Pittsburgh area?
So for the past 18 years, we've been providing concierge aging life care management service. And what that means is families hire us. We are private pay. Long-term care insurance will typically cover our costs, but otherwise we're considered private pay. And they're usually contacting us when they're having some crisis with their parent. Maybe their parent is in the hospital and the hospital has told them they can't go home. Typically they can. We know how to manage it so that they can, and they don't have to go to an assisted living or a skilled. Or they're calling us because they've been trying to manage their parents' care from a distance. So they're in another state. They may have 3 or 4 siblings and they're all in another state, and their parent has maybe mild cognitive issues, and they're just concerned. She's living in some big house, and they're over the phone, they're noticing a decline. So in person, there's always a much further decline than what you're seeing. So, and when families hire us, we manage the person's whole entire life. And if you go to our website, holisticaging.com, we have a picture graph of a tree. And that tree explains the different services that we offer. So one, or how we manage the care. So when we do an assessment on a client, we are looking at, I mostly have nurses as my life care manager. So we're doing a whole physical exam. So we're compiling information, we're contacting their doctors, and we're getting a really good idea of what's going on with them physically. Frequently, there's no one in their family that's been able to do that. Physicians love our presence, and the family loves that piece. So we're usually solving, sometimes we're getting a diagnosis for a dementia disorder, which has been classified as dementia. That could be one example, but we're preventing hospitalizations and movement as much as we can from the home to another place. And right now, that is probably one of the most important things that you want. You want to keep your family, your parent in their house as long as you can. Our whole concept of that has changed compared to what it was before COVID. So we're managing that disease as clinicians. And then we're also doing neurocognitive assessment. So a majority of our families, the parent has some type of memory issue. So we're doing an assessment on that, and we're drilling down to find out what kind they have, because the kind they have makes a huge difference on how we're going to be planning out their life and how we're going to be managing it. So we can work with physicians, and just through experience, we're pretty much able to, for most people, narrow that down to exactly what the dementia, which, you know, there's about 40 of them besides Alzheimer's disease. We also look at all the financial and legal things that you need to have in place as you age. So it's very important that living wills are written. We work with some great elder law attorneys we can refer people to. Sometimes specific ways of managing your money is really important, putting in a trust or not, depending on what your long-term needs are. And any entitlement. So veterans benefits, for example, is one great entitlement. There's huge lower income entitlements available in Pittsburgh. So we look at all that, you know, we're helping the family with all that also. We also look at all their medications. We have a huge polypharmacology in Pittsburgh, which means most of our elder people are on way too many medications. When we do an assessment, the average is 15 medications. And, you know, when they study medications, they really don't look at the effects that multi-dosing of different kinds of meds have. They just don't study those things. So, you know, we use specific geriatric criteria, try to narrow it down, things that there's probably about 10 medications that someone who's over the age of 65 should never be on. So if we see someone on that, we work with their doctor and their family and try to get them off of those. And then there's other ones that, depending on physically what's wrong with them, it's better as they age, that they be off as many medications as they can. So we do that also. And that continues. And we also try to pull in as many local resources as we can. So we're familiar with all the caregiving agencies. We have our own senior care consultants that we use for some of our clients. And what we're trying to do in a nutshell, and we're managing all these different dynamics, is make sure the person is aging well. And we start with real simple things. We do a nutritional assessment, and we start with food as medicine. And honestly, if we can improve the diet of an older person by maybe increasing protein a little bit, getting away from those processed foods, it's amazing. And drinking some water, those three things, is just amazing how you can really improve the health and cognition of some people. So we've been doing this 18 years. We have a passion for it. And the present situation has changed our approach. So,
how long do you generally work with a family for?
usually until the person dies.
Okay.
Yeah, so we're getting them, without this sounding gruesome, we're getting someone typically at the end of life, people in their 80s. It's usually to the point where the family's like, I just can't, I really need an expert's opinion on what I need to do. And they could call us in just to do an assessment. Some, maybe 10% do that. Most of them hire us, and we manage the care throughout the entire life and until death. And we make sure death is a very positive experience. We work, when someone's dying, you're not just working with the client, you're working with the family and taking them through that whole dying process and making it a positive event more than a terrifying one.
So I know you touched a little bit on COVID-19, how it's affecting your services. Can you expand on that a little and how that's going for you right now?
Yeah. Well, we're not as busy. I should say my staff is not as busy as they were, but I'm busier than ever, just trying to think of new creative ideas. So when our clients, when we move them from home to an assisted living or possibly even a skilled, we look at, are they a danger to themselves or a danger to others? And at some point that happens, or else economically they can't afford 24/7 care. That's $350,000. I mean, it's a lot of money a year. And it's a lot. So I use a formula. Typically, if you need more than 8 hours of caregiving service, most assisted livings, it's less expensive to reside in assisted living. So, danger to self, danger to others, or cost of service. So we do have a significant number of our clients that are in assisted livings, or I think we have one that's in a skilled facility, and it has become, we're not allowed to see them. And we move them to these places because we're managing their medical care. Assisted livings don't have oversight in medical. They're not licensed to do that. They don't advertise they do that, and they don't provide that service. So it's been challenging. Most of the assisted livings we're working with are doing the best they can to help us. But when you're Skyping with someone, or you're FaceTiming with them, you can't do a physical assessment, but you're getting a little bit of idea. So that's what we're doing. We're trying to move towards technology. It's very hard with an older person. They don't understand the screen. They're touching the screen. But that's where we're at right now, using technology with our clients in assisted livings and skilled. I hope, and there is one that actually has let us in, and our client is doing really well. The other ones, they're so lonely, and some of them don't have, they don't have anyone here but us, and we're not allowed in. They're not on a first floor. We can't visit them at a window. It's sad. It's really sad, really.
It is sad.
But we're trying our best. Hopefully, I think I'm hoping that when they see just how dire some of these people are with loneliness and depression, and that's killing them even more than COVID, maybe they'll make some kind of accommodations for medical people, like services like us to go in with, you know, I-95 mask and whatever they need to. So we're hoping that that might happen. If it doesn't, we'll just plug along.
Yeah.
One thing nice is we take our clients to the doctor's appointments. So we have been able to, now they're letting us do that. So at least we're getting that outside contact with them, and we're able to see them physically. So that's just new. That just started like this past week.
Yeah, and things might continue to keep changing. You know,
They are.
day, so maybe things will change even when we go to the yellow and on Friday. So we'll see.
That's right.
So is there anything else that you'd like to share with anyone out there? You know, maybe signs to look for so that people know when to call you, you know, especially from a caregiver's perspective?
Usually, what I would recommend families, if they are, typically there's one person handling everything.
Mm-hmm.
And then there's other siblings that person perceives as, or they're not participating as much. We work amazingly well with families, and we can usually get everyone to pitch in somewhat. And if not, you know, we're helping take over that primary person's role, to however much they want us to. So I would say don't wait for an emergency, because we can prevent them from happening. If you have a family member home alone now, you know, we have masks that we can go in, and we're visiting all of our clients that are in the home. Not one of our clients has been infected, and not one of my staff has been infected in any way. So we're nurses. We know how to keep people safe, and we're doing that. So I would encourage people to call when they're feeling, before they get to the point where they're overwhelmed and they're thinking of placing their parent. Mm-hmm. They think, a lot of families think that placement is the what's going to solve all their problems, and it typically doesn't, especially now. So, you know, feel free. I would call us. We can even just do, you know, I give a half-hour free consult to anyone that wants to call and ask more about our services. But you really want to get in. We can be so much more effective if we're getting in and preventing that hospitalization, rather than you calling us after the hospitalization has occurred.
So Bobbi, what's the best number for them to reach out to you?
So our office number is 412-486-6677, 9 to 5, Monday through Friday. And we do respond after hours for our current clients for emergencies and on the weekends. And our website is holisticaging.com. A lot of great information. There's a great blog that has articles that anyone could use to help them manage their parents' care. Sign up for our newsletter, which we're down to getting it out once a quarter, but hopefully that will improve. We were doing once a month, but other things have gotten in the way.
I get it. All right. Well, thank you so much for your time today, and we'll keep in touch.
Yes. Thanks for having me on. And I appreciate what you're doing with the Senior Blue Book. This is a great resource for, you know, everyone, you know, caregivers, case managers in the hospital. It's just yeah, you're doing a good job. So
Thank you.
For that.
Thank you. Thank you so much.
Okay.
Well, I'll talk to you soon, Bobbi. You have a great day. Stay well.
Okay. Thanks.
All right. Take care.
You too. Take care. Bye-bye.